In our Health Watch this morning, there are growing concerns over an outbreak of mpox, formerly known as monkeypox. Yesterday, the World Health Organization declared the spread of mpox in Africa a global health emergency. More than 17,000 confirmed and suspected cases have been reported in Africa so far this year. That is more than the total for all of last year. Health officials are warning the potentially deadly virus could spread internationally. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF. Good morning. Good to see you.
Good morning.
So, Celine, this is the second time in 2 years that the WHO has declared mpox a global health emergency. What's different this time around?
This is a different strain. This strain is more mortal, so in other words, causes more percentage of deaths. It's also more transmissible. It spreads more easily from person to person.
So the last time we were facing something like this, describe the transmission for that first strain and how it's transmitted this time around.
So that last outbreak that we saw about 2 years ago was primarily being spread among men who have sex with men, bisexual men, transgender people. What we're seeing this time is some 85% of the cases are among kids. And so it's the poor hygiene that you see among little kids playing with each other, skin-to-skin contact. That's how we're seeing this being transmitted now.
Given that kids, and I'm learning this now, bring home every single thing that they pick up at the playground or at school, how do you prevent it from spreading?
Right. Well, a lot of it has to do with, some of the things we talked about early in COVID, which is looking for symptoms, testing, doing the surveillance. A lot of what we've been doing as the United States has been supporting the Democratic Republic of Congo, which is where the majority of these cases, we've been supporting them to do that surveillance, to do that diagnostic testing so you can isolate and prevent further spread, further transmission.
So if parents are worried about the spread, what do the symptoms look like? What should we be looking for?
Well, so first of all, the risk here in the United States, at least right now, is very low. We have yet to see any cases here. So I don't think you should get too alarmed if you see a child who looks like they have the chickenpox. It probably is the chickenpox, but that's what the mpox rash looks like. The disease is more severe in that you have worse flu-like symptoms. You might also have swollen lymph nodes, but the rash is quite similar to the chickenpox.
And what about vaccines?
We have a vaccine. It has been used in the prior 2022 outbreak. Even then, less than a quarter of those eligible during that outbreak have yet to be vaccinated or have been vaccinated. But we don't have nearly enough vaccine to cover the need in Central Africa. We would need about 10 million doses, and we're not nearly there.
Wow, unbelievable after all these years. Thank you, Dr. Gounder. Appreciate having you always.